went down, and during that, they took me back in the hospital, did a bunch more research, and the last thing they did was called an ultrasound air bubble test. Because I started to feel great. They couldn't find anything. And I'm like, okay, I'm making this up. Maybe I'm just thinking this is happening. And when they did it, they found a hole in my heart, and that opened up, and they went to that, and it was crazy.
Yeah, and
is that my heart actually there?
No.
You managed to.
You still have
yeah,
yours
we actually have Michael's heart.
You still have yours inside. And one thing
I just have a metal.
We're gonna let you.
Are you ready to hold some organs?
You're gonna play
This
doctor
is a first
now.
right here.
Yeah.
I'm still just sitting here in shock that you look as good as you look. You've been through a lot.
Yeah.
I mean, come on.
So what happens is a foramen ovale, or this opening between the two atrium, the left and the right atrium, is normal for the baby in the womb, inside the mom, because basically the baby's getting the oxygen from the mother through the placenta. Now, what happens when your lungs expand when you're born is basically there's a pressure that builds up, causes this little flap that gets closed with that pressure. But for some people, it doesn't close for whatever reason. Usually that doesn't cause a problem unless sometimes you're at increased risk of a blood clot or something like that, and then that's when they want to fix it.
And it's really interesting because we've talked about DVTs on the show before, deep vein thrombosis in the legs. Usually, if you have one, it'll come up in your heart. It'll go through the right side of your heart, and if you get anything, you'll get a blood clot in your lungs. But when you have this opening, PFO in the atrium, that blood clot can come up, just skip straight over to the left side of your heart, and your left side of your heart pumps it straight up to your brain, causing a stroke.
That's
So
exactly.
that's why you gotta
And that's
get
why
it
you
fixed.
fix it.
Yeah.
I was Q-tipless, so I didn't know where that hole was. And I was so intrigued by it. I'm like, this is what my heart looks like? Holy.
I think at this stage, Brett,
It's a good piece of meat right there.
You know, the irony of everything we've been talking about, everything that Brett's been through, is this isn't even the medical condition he's the most passionate about. Will you stick around? Because I want to talk a little bit more about the type 1 diabetes you've been dealing with your whole life.
I'm here, man. Loving it.